Okay, our next speaker is Dr. Marco de la Cruz. He owns a family practice in Lincoln Park, Illinois, focusing on whole health wellness, and that is the name, Whole Health Wellness. He's the author of a book called Balancing Act, a mind, body, spirit approach for optimal health. I can tell you that I have learned, he's also one of my doctors, by the way. I've learned almost everything I know about nutrition from I call him Dr. Marco. He prefers Marco, but I like Dr. Marco the best. I show up to every single appointment that I go to in his office with a packet full of information on things that I found on the internet that I want to teach him, things I want to show him. Anybody that's ever treated me will tell you that that's just how I am. And I don't always agree with him on everything that he says, but I always learn something from him, and it's almost always nutrition. So he is responsible for my nutritional well-being and has really guided me and redirected me into a more healthier way of life. And I just really absolutely love him for it. And I'm sure that you're going to love him too. So please welcome Dr. Marco.
Okay. Well, anyways, I'm happy to be here. Thank you for this opportunity to try to share what I've learned. Most of what I'm going to tell you is what I've learned about medicine. I'm a family physician. I used to work for the Rush Lincoln Park office for like 29 years. And, but I'm going to show you some slides that I've put together because, the way I practice now after 35 years is very different than I did, when I first came out. When I really first came out, I really thought it was about testing and medications, and that's the way I was trained. That's the way I approached it. So since then, I've learned so much, and I've learned more importantly about the whole mind, body, spirit thing. Even that itself is another story. I do a lot of lectures on that. And so let me just try to give you an overview that I hope will help you, because the thing about having any kind of chronic disease means that by definition there isn't a simple solution. Okay, and that's when a more comprehensive approach becomes essential. There isn't much to talk about if you have appendicitis. It's either get the surgery or don't. But any kind of chronic condition means that a lot can be done, but it's not going to be the usual medical bag of tricks. So what I'm going to be talking about, again, is about restoring health, what I've learned about and I've learned it from other doctors, other teachers, and then a lot of it from my patients. And I'm going to try to go through it because it's more, and I guess you can ask questions like Gracie said at the end, okay? But interesting, this quote from Thomas Edison, the doctor of the future, kind of what I'm trying to hint at. Because even as I'm listening to Dr. Doshi, and it was very instructional, I learned a lot. Like he says, we don't know much about that kind of stuff. But it was nice to see near the end when he was talking about some of the therapies that included psychotherapies, cognitive restructuring, stuff that is really part of how can I live my life better. Okay, he probably doesn't know enough to talk about nutrition, which is how I'm going to show you why that's such an important part of any attempt to restore health. Okay? What I thought of doing, and just for lack of time I won't do it, was show you the last 2-3 slides first, to say this is where we want to end. But the essence of, if I were to summarize the lecture right now, it would be to tell you the way my practice has changed. If I see a patient with CRPS and I see a patient with rheumatoid arthritis sitting next to somebody with psoriasis and multiple sclerosis, now all I see is inflammation. Okay? Inflammation is pretty much the essence of most chronic disease. And so that's why it's so important to address that, which even doctors, even wonderful doctors like Doshi, may not bring it up because there's a lot you can do about that ultimately. Okay. The way I got into this kind of stuff is when I came out of residency, I thought that I was going to cure 90% of the stuff that came to my office. And I could. the acute stuff, you know, the injuries, the strep throats, the pneumonias, those, yeah, you could cure them pretty well. But after a while, I started to notice that most of this stuff was chronic. And that we really didn't have anything that would cure. And I was using a lot of ibuprofen, which I would soon learn was actually harming their kidneys and harming their intestinal tract, things like that. So I started looking for answers, and that led me to the whole area of mind-body medicine. And I found all this information, that all this research had already been around for a long time. So I didn't invent anything, I just took advantage of it. And along the way, I learned that 80 to 90% of chronic diseases, in general, have an inflammatory component, okay? And the biggest causes of inflammation, boom, okay? And I put stress at the top because it definitely is. Stress raises inflammation. And I'm going to explain a little bit about it and why you can turn some of that around. And why, and I'll give you a clue. Again, nothing's 100%, but I will give you this clue that if you have any kind of chronic ailment and you can make it better with prednisone or any of the strong anti-inflammatories, then you know you're dealing with inflammation, okay? You're not dealing with a deficiency of a prescription drug. They might be helpful, but they're never going to address the real issue, okay? So these are the most common, and stress is at the top, and mostly with patients. By the way, what happened with me when I started learning about mind-body connection and how stress caused illness, even before I knew the word inflammation was the connection. I started teaching, I came out of residency in 82. By 88, I started teaching my patients stress management. I had a class called Path to Wellness. Used to do it on my day off in the evenings. And that's how it all came. And then years later, you know, this book is pretty much the outcome of what I used to teach in my classes. But these are the top ones. And generally, I'm happy to report that for most people, the big one is food, okay? And if you've gone to any chiropractors or any natural physicians, they're always going to tell you, get off grains and dairy. It's like an old record, but there's a lot to it. And I see it in my patients all the time. And so the other ones are pretty straightforward, but you know, I'll kind of weave it together for you. So pretty much we know now inflammation is at the heart of everything. I had this chance to study with Dr. Gundry, and I'll show you his book a little bit down the road. And he helped me see how even heart disease, which is, by the way, I mean, a lot of these illnesses, chronic illnesses, are annoying and debilitating and all that, but heart attacks are still the #1 killer. And heart attacks, we know now, are not about cholesterol, they're really about inflammation, okay? And at my age, I'll be 65 in October, and my biggest concern now is really avoiding Alzheimer, which I encourage all my patients because it's so devastating how it robs you of your life. And that's about inflammation. Right now, to my knowledge, there is no drug that I would recommend for anybody for Alzheimer, but there's a lot, and I'll show you, like in Dr. Perlmutter's book, Grain Brain, a good place to start if you have any concerns about that for you or a loved one. So the idea that the power of the diet, mind, and lifestyle is tremendous, and that's the good news. Because remember I already told you, by definition, if you have a chronic illness, even the ketamine is not going to cure it. Just by definition, the fact that it's chronic, it will help, and it sounds like it can be real, real helpful, but the system and the cards are stacked against you. So what if this could reduce your symptoms by 10, 20, 30, 40%? Okay. So why do we get sick? Usually we get sick for whatever reason, generally other than the acute trauma, but generally we get sick because things are out of balance, right? And some of us already know how to get things into balance. If you ever have a bad flu, if you stay home a day or two, the body will generally restore itself. Especially if you put away the alcohol and put away the sweets for a day or two. Makes a big difference. Things that can cause more inflammation. So in general, what we're realizing now is really disease has to do with the interaction between your genes and the environment. And the environment in this case is stress, how you're sleeping, how's the marriage, your relationship with your higher power, all that is your environment. and you begin to, hopefully by the time we finish, you'll get a gestalt, a sense, oh my God, how it's all really connected, and there's so many things that you could already start doing. And by the way, you're doing them already, you're just not doing them comprehensively, or you're not doing them enough on a regular basis, okay? Lifestyle, things like laughter or worrying, prayer, they actually turn genes on and off, okay? It's diet especially. So for example, even if both your parents were diabetic, if you ate right and exercised, you probably wouldn't get the diabetes, but you'd always have the genes. And I have patients who are diabetic or were diabetic. By definition, they wouldn't be diabetic anymore because they changed their diet and lifestyle. And, but they still have the genes for diabetes. As long as they eat right, they're going to be okay. Oh, God, I got a beautiful 35-year-old with Crohn's disease. And when she came to see me, she was getting one of those anti-inflammatory IVs that you see advertised on TV. That they can be quite effective. They run about $1,000 or more a month, and you got to do it like every 4 to 6 weeks. Anyway, so we worked together, and she understood it, changed her diet, repaired the gut. I'll mention some of that, and it's been 2.5 years, and she's healthier than she's ever been. Now, obviously she still has the genes for Crohn's disease, but she's on no medications other than a few supplements. But if she starts eating grains again, she'll start getting loose stools and abdominal pains. These are real stories, okay? The nice thing is the body is always trying to repair itself. It really is. Until the day you die, the body will always try to rebalance itself. And if you give it what it needs, it can do it better, okay? So if you have a cut and you're malnourished, that cut will take a little longer to heal than if you're very well nourished. Now, I brought this up because if nothing else, what I want you to get from our time together is learn to practice breath awareness, which I've been doing now for years. And I'll take a minute to show you. What I want you to do right now is really, while you're sitting there, just, if you can, try to just observe your breath. Just try observing your breath as if you were going to count your breaths. Okay? If you've done any yoga or meditation, then you already know how to do this. But speaking of, since we were talking about pain here, back in the 80s, when I was learning about mind-body connection, I went to Herbert Benson's conference, week-long conference, and they were using mindfulness and meditation to treat chronic pain. If you know anything about mindfulness and John Kabat-Zinn's work at Mass General, it was all about treating patients with chronic pain back then. Okay? But anyways, just simple observing your breath gives you a centering tool that actually will lower inflammation. Because one of the things that I've noticed in my own life is also the difference between pain and suffering. Pain is my injury and suffering is my worries about it. Okay? So if I can teach you to be more centered, if I can teach you to meditate, if I can get you to pray more, you'll probably have less inflammation because that's the way you're wired. That's one of my theses. Okay? But it's a lot easier to try to change your diet than to manage your stress. So, anybody practicing breath awareness now? Okay. What you should notice when you do, the few seconds when you're with the breath, that you feel slightly calmer than when you weren't doing it. And it just becomes a tool. It's a place for you to go to where you don't have to rehearse your problems or replay the past, etc. Just be here. Right now, you're in a very comfortable place. Temperature, I think, is good. You're around nice people. Great speaker. Free great speaker. It doesn't get better than that. Only more expensive. But so I'll keep referring back to you. Just say, go back to your breath, as I've done with many of my patients. I honestly don't know how people get by without it. Okay, so if I could spend the whole time, but this is what I want you to understand. I want you to understand what is inflammation, okay? The inflammation basically means your immune system is trying to protect you. When you cut yourself and the next day you notice a red area and swollen and a little painful, That's inflammation, which means your immune system is trying to do what it's supposed to do. So your immune system, and even if you have rheumatoid arthritis, the immune system is doing what it's supposed to do. Protect you and repair, okay? What they don't teach me in medical school, and they don't teach us doctors, is what's irritating the immune system? Why is the immune system overactive? On my thyroid, and we call it Hashimoto's, or on the cartilage in my joints, and we call it rheumatoid arthritis, etc. This is where I need you to start owning it, because this is all part of your system. Here's those biggest causes of diseases. Guess what? Very similar to what I showed you earlier, the biggest causes of inflammation. Things that irritate the immune system. Stress is still number one, because stress by itself raises inflammation because it weakens the immune system. By the way, that's the connection. Most of us, how many of you have already figured out that increased stress makes your symptoms worse? Okay. Generally, it does it by suppressing the immune system, okay, or overstimulating. But again, it impacts on what I just tried to tell you. My immune system is involved. Okay. When I worry, I'm going to have more inflammation. So if I can do more breath awareness, if I can do more spiritual work. Okay, and to me, spirituality, by definition, has to lower inflammation. Anything that makes you feel safe, loved, at peace, will lower inflammation, just like anything that makes you worry about the kids, about the economy, about the presidential race. Anything that makes you worry, it's going to raise inflammation and generally worsen how you feel. Okay? Sugar is high on the list. Sugar by itself is inflammatory. Our bodies just can't handle it. 10,000 years ago, around the time that we became agricultural and started eating more sugar in the form of grains as well, but even back then, I would estimate that a typical human maybe ate half a pound of sugar a year, while today the average American might eat 150 pounds of sugar a year. If you're a teenager, it's probably even higher, right? But get that, more than 300 times what we ate 10,000 years ago, but our bodies haven't changed. But anyways, sugar by itself is inflammatory, and sugar tends to raise insulin, and insulin is extremely inflammatory. So when people are pre-diabetic, they're running around with higher insulin levels. Even though the blood sugars look okay, the body has higher insulin levels to try to keep the blood sugars controlled. That's raising more inflammation, setting you up. And that shows up in the kidney damage, shows up in the vision damage, etc. That's what I was just saying. Malnutrition. If you lack the nutrients because of a typical, they call it a SAD diet, Standard American Diet, and I'm not here to bash anything. I'm just here to explain to you so you see how it all goes together, why little by little, if you move away from, like I tell my patients, from grains to greens, little by little you start moving over, you start picking up more micronutrients. Generally, I had some fettuccine Alfredo yesterday, which I rarely do, and I have a small amount. Wasn't much nutrition there. It was great, though. Tasted good. But I can't say there was much nutrition at all. But it did taste good. But if you saw my smoothie that I have every morning, and I brought like 30 copies of my smoothie recipe that I give to my patients, my smoothie has a cup of greens. You can get this all at Costco. It's on the sheet. My greens are kale, chard, and spinach. 2 cups of that, 1 cup of broccoli florets, 1 cup of mixed berries. That's the essence of my smoothie. I love the patients that go, oh yeah, I'm doing smoothies. Yeah, I got mangoes in there and bananas and strawberries, Now, again, you want to cut the sugar, so the fruits that we would use would be low sugar fruits. But when you start moving, the only place I can tell you to get nutrients is going to be the plants. So if you're not eating the plants, that's how I got into the smoothie thing for my patients, and then I started doing it. Now I do it 7 days a week, and my kids do it too, which is annoying, because I used to make a batch last me the whole day. Now I have to divide it up with them. So if I don't get those first 12 ounces at the first pour, I don't get any. But when you start making it for yourself, you make a big batch, like 24, 30 ounces. You have some for breakfast. If you're still hungry, go ahead, have your eggs. Have some protein, not carbs. Okay? But again, it's about getting closer to the more nutrients. How many here really agree with me that generally the body is so remarkable that if you give it what it needs, it will try to repair itself? Do most of you agree with that? Okay. All right. How many of you are doing that? Well, if you're like my patients, not too many of them. And that's what we need coaching in, right? That's where eventually, like that first quote from Thomas Edison, the physicians of the future are going to tell you, dude, here's how you restore your health. I'll just remind you, I'll coach you, I'll show you the evidence, okay? But this is what I want you to get at. There's so much you can already do, okay? And yes, the insurance companies, they're not going to fork up any more money. And the doctors aren't going to learn that stuff any faster than they are. That's the dark side. That's a human condition. That's why you want to grow in spirituality, okay? And by the way, that's one of my favorite topics for health because it lowers inflammation. And by the way, how many agree that laughter is one of the best medicines? What do you think laughter does to inflammation? Lowers it. Okay? Just like meditation does, mild exercise, watching the baby, especially when it's somebody else's baby. No, like watching toddlers. Do you ever notice how if you sometimes you see little kids walking by, the 3-4-year-olds, and they're kind of tied together? It just brings something. Okay, that's the kind of stuff that lowers inflammation. All right? If you have a spiritual card, I keep telling my patients, you got to double up on it. Okay? All right? That's a must. And I keep telling you. Anyways, so malnutrition is a problem. Toxicity. I wasn't as aware of this, till Dr. Younger's book that I'm going to show you in a bit, and I see it now because I'm one of those Lyme literate doctors now, which I'm telling you, it's not what I wanted. God knows, I'm getting close to retirement. I should be coasting, right? I put in 35 years, everything's going to be mellow now. And then these patients started showing up, and they're telling me they have Lyme disease, and nobody else will treat them, and what can I do? I couldn't walk away. But I'm working harder than ever, but I'm learning like crazy. With the Lyme patients, by the way, who have everything, a lot of what you guys have, and a lot of what you guys have might be Lyme and you just don't know it, by the way. But the point is that a lot of that stuff improves when you improve detoxification. And it makes sense. We learned that from Dr. Wall, so I'll show you later. If you can't detoxify properly, first of all, if you don't have micronutrients, your mitochondria don't work. If your mitochondria don't work, then your cells can't function. So your liver can't detoxify, kidney can't detoxify like they're supposed to. So all these toxins back up, and they clog up the works. And you get more or less inflammation if things don't work. Probably more. There's that I word again. Oh, I'm not even bringing up toxins in the environment. Okay, we're not even talking about the lead in Flint, Michigan water, etc. I'm talking about just every day, even just from the foods you're eating. By the way, so when I eat processed foods, am I eating more toxins or less toxins? More, right? More chemicals. A lot of these, I had a great time trying to figure out one time, how your mind just goes off on its own. And I'm wondering, one time I tasted some of those Pringles pizza flavored chips. And I remember asking myself, gee, I wonder what pizza company, did they work a deal with Giordano's or Papa John's? Like, what pizza are they using to get that pizza flavor? Do you guys know? Right, it's none. It's chemicals that our bodies have never known, that our bodies have never been genetically ready for, but it still has to process them, right? It still has to detoxify them, etc. So that's what I mean. So as you get closer to better eating, you're going to start reducing the toxins. And this is the big one. This is so big. Because when you get toxic in mind or spirit, you're less likely to eat well. You're not going to sleep right. You're not going to exercise. The thing about stress, why I say stress is the number one cause of inflammation, is because I'm probably one of the few stress specialists you'll meet. And I'll tell you this, the problem with stress is when you start getting stressed out, all the things that would help you are the things you stop doing. You stop eating right, you stop sleeping, you stop socializing, at least getting some support from your loved ones. You see how it goes on? You stop the positive thinking. So all the things that would help you undo the stress are exactly what you don't do. Okay? And again, I'll tell you again, spirituality, and I want to just, I'm not here as a religious nut at all, I'm here as a clinician telling you the spiritual definition has to lower inflammation. And by matter of fact, that's how you can tell if you're growing spiritually, that you worry less than you did 5 years ago. If you're still worrying like crazy, you might be religious, but you're not having grown in spirit. That's just a clinician's point of view, okay? Likewise, if you've been meditating for 5 years and you're not more at ease than you were 5 years ago, you're not meditating right, okay? All right. So this is the way most of us grew up. We grew up, I mean, medicine, this is medicine at its best. They came up with a pill that they found in a mold around World War II, penicillin, and it can kill pneumonia, the pneumococcus. And at that time, pneumonia was the #1 killer. It wasn't heart disease. It was pneumonia. Now it's like 3 or 4. But that's what we'd like to see, right? We'd like to think that stuff will cure. But let me put things in perspective for you, too, is that even when you talk about this case, when you give somebody penicillin and they get better, what cured them? Ding, 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 ding. For $200, no. Well, right, you're tempted to say it's the penicillin. But we learned from the HIV patients in the 80s where we threw the best antibiotics at them. If they had no immune system, they couldn't survive. So what the penicillin does, it just lowers the bacterial count so that your immune system can clean up. That's why we're never going to, like, for example, beat ISIS from the air. You can use the bombs, to reduce the count, but you have to have an immune system go in and clean it up. Okay? So even in what we think, the strep took care of the penicillin took care of my strep throat, because you had a competent immune system once you lowered the count. Please understand that. We learned that with the HIV. You could, kill the bacteria, but if there's no immune system. So the immune system, as you already know, it's very sensitive to stress, very sensitive to inflammation, very sensitive to sugar. You could see white cells in a petri dish and take a dropper with sugar and just put 2 or 3 drops in it, and the white cells stop moving. Okay? Sugar is a real harm to your immune system. So for restoring health, it goes back to, like the gentleman was saying, Dr. Doshi was saying, if you know how it works, if you know the mechanism. Okay, so if you know how we get sick, it gives you an idea what's your path to wellness. For food allergies, an anti-inflammatory diet, basically start with grains and dairy. All my patients get a sheet, here's the diet you should follow, but I'll show you a couple books that will drive it home for you better. I don't test for food allergies. I think it's a waste of money. I only do the test when patients ask for it and they insist. It's okay with me, but I say, I don't need it. I just want you to stop these foods anyways because they're inflammatory, period. Okay? And most of them, when they do it, they get better. Anti-inflammatory diet is going to be what? Take out grains, dairy, a few other things, but mostly grains, dairy, and bring in what? The greens, right? Go from grains to greens. Enough's been said about sugar. This is a wonderful book where I learned a lot about detox. In essence, here's what I've learned. If you can improve your detox system, your immune system will work better. As I mentioned earlier, if you're like most of us, the toxicity in us is going to impair your mitochondria, which are very, very sensitive. And so your body cannot work well if your mitochondria, which is where you make energy, if they're not working well, you're not going to. The paleo diet, it's important to know it's not a fad diet, okay? Paleo diet is just eating more like we did 10,000 years ago, okay, before grains came. Now, the great thing about grains is that they allow us to not lose as many people to starvation. But it's interesting to note that the medical anthropologists will tell you that the first time they see arthritis in the knees or arthritis in the joints is after grains came, because they're just inflammatory. They could be good, but maybe not to have every day, 3 or 4 times a day like we did. Okay? Great book explaining the paleo diet. He does a great job. He's got a great website. Just check Rob Wolf, write that down, Paleo Solution, Rob Wolf. Okay. By the way, Atkins' diet is paleo. Where he betrayed us is that, I don't know, this is just my own impression. Maybe the editor is just going for the money, instead of saying, get off grains, get off the carbs. They instead focused on, you could eat a bacon cheeseburger and lose weight. And you could, because you're not eating the carbs. But they didn't say, go from grains to greens. That's what we needed to hear back then. Okay? This is Dr. Gundry. It's his diet that I give to my patients. He's the one that showed me about reversing heart disease, but actually reversing most chronic diseases by taking out inflammatory foods and using certain supplements. Such fish oils, by the way, are very anti-inflammatory. Okay? Curcumin. This is my most recent recommendation to all my patients, because as I said, most of us would do well to try to avoid Alzheimer's. But it's the same running theme. There are a lot of depression, a lot of anxiety, a lot of OCD is due to inflammation, because the brain is extremely sensitive to inflammation. It doesn't do well with it. By the way, we know that people with inflammatory conditions like rheumatoid arthritis, not only do they have more heart attacks, remember I mentioned heart attacks are about inflammation, but they also have more depression, etc. And you think, well, I would be depressed too if I had pain. No, you're having depression because the inflammation is affecting your neurotransmitter synthesis. Okay? This is probably the greatest book for all my chronic patients, for all of you with any chronic illness. I urge you to check her out. Amazing story. She's a physician, and around the year 2000, and you can watch an 18-minute TED Talk. I give that to all my patients. If you want to work with me, I say, just start here. 18-minute TED Talk called on YouTube called Minding Your Mitochondria. She tells her story. She gets diagnosed with MS in 2000. Like a good doctor, she does everything they tell her. By 2005, she's in a wheelchair. She realizes they're not going to be able to help me, goes online, starts learning more. First thing she learns is that, hey, if you have an inflammatory condition, you probably shouldn't be eating grains and dairy and legumes. So she converts herself. And by the way, she had been a vegetarian for like 20 years. So you would never expect this to happen to her. But like most good vegetarians, she was getting a lot of her carbs from grains, which she now realized, she's got MS. MS is an autoimmune, it's an inflammatory condition, like psoriasis, like rheumatoid arthritis, like heart disease, like Alzheimer's. Okay? All of a sudden, you see how these things are all connected? I mean, that's the good news. That's also why when Japanese, they love us, and they start eating like we eat, and they get all our diseases. They used to have like no heart disease, no breast cancer. But they're having fun eating, though. You got to admit, that's some of that food. All right. Functional medicine really deals with some of the issues I'm bringing up. You know, how diet works with genes and how your environment turns genes on and off. That's the future of medicine, I think. It's very, very it's very restorative oriented. So anyways, what Dr. Walls learned is, number one, the paleo diet to eliminate the inflammatory foods. But she took a course in functional medicine where she learned about chronic diseases. What supplements would help me restore my health. Okay. Basically what she did was she took out the foods, as I mentioned, that were toxic, they were inflammatory, but she put in foods that deliver nutrients. Okay. She's the one that taught me about mitochondrial dysfunction. As almost all disease begins there. Either because you're not eating well enough, or because the toxicity is building up. So that all needs to be if you have a chronic disease, she would say, these are things you probably have. Okay. All right. Your mitochondria aren't working well, you have too much inflammation, you definitely have food sensitivities. Why? Because of leaky gut. Anybody here know what leaky gut is? Some of you, I know some of you know. Leaky gut is increased intestinal permeability, which means that normally the lining of your gut is like tight like this. As food passes, nothing gets in unless a receptor grabs it. When you have too much stress, too much alcohol, too much ibuprofen, Montezuma's revenge, that trip to Mexico, okay? It opens up like this. This is what they mean by leaky. Now things can get in. And the immune system, doing its duty, has to react. And that's the beginning of the immune system. Once that gets going, just a matter of time before that shows up in your brain, in your nervous system, in your joints, in your thyroid, etc. So this is where, again, you can take a lot of this back. So how do you restore health? You work on repairing those things. That's what we learn. Again, in general, this is what you see. The mitochondria aren't working, inflammation's on board, the food sensitivity are always there, because when you have leaky gut, that's why you start getting sensitive to more and more foods. Plus, certain foods are just irritating to begin with, as we said. Toxin overload because there's toxins in the wrong foods, toxins in the environment, etc. Okay. So this is, again, how do you repair those? With diet, repair the gut. So there's a lot of good supplements that will help with that. That's what we do in our consultations. This was her diet. Remember I said she did two main things. The two main things she did was take out the inflammatory paleo stuff and to put in 9 cups of fruits and vegetables a day, which seems no way, too much. But the smoothie recipe that I have here gives you 4 to 5 servings just with the smoothie. So it isn't that hard to get. And the way she broke it up was very specific. The leafy greens to get the antioxidants, the sulfur-rich vegetables to repair the mitochondria, and support detoxification, and the colored fruits for more antioxidants. Okay? And of course, gluten-free, all that kind of stuff. So for me, that's why I told you, if you only read one book of the ones I show you, get hers, or check her website, Terry Wahls, W-A-H-L-S. She has, to my knowledge, the best roadmap for any chronic disease. And she's got a lot of research already done in the last few years. Because if you see that TED Talk is 5 years old. Since then, she's had research supporting that not only will her protocol help MS patients, it'll help almost any autoimmune disorder, and also just chronic inflammatory. So if there's any inflammation in whatever disorder you have, because not everybody here is going to have the same CRPS, there's different things going on. You can take it all back. I always tell my patients, use your spiritual card. Religion is not about spiritual. How can I say? Spirituality has nothing to do with religion. Religion is about spirituality. But spirituality is like the road. Religion is the map. There's a lot of different maps. Different cultures come up with their own map, and they're good maps. But they have nothing to do with the road itself. Okay, so if you have a spiritual card, I tell my patients, I am not inclined to convert you into anything, but if you have it, double up on it, because that will lower your inflammation. That's MD is me. I put that there. Because I tell my patients that whatever makes you feel loved, safe, and peaceful, like meditation, again, playing with children, falling in love, good sleep, good vacation, all that good stuff will lower inflammation. So, good, we're almost done. So, in my book here, basically what I ended up putting together was a program based on energy. Things that give you more energy are going to make you healthier. But I could also say, where it says energy gain, I could say lower inflammation with greens, exercise, sleep, breath awareness, optimism, prayer, love, gratitude. Okay? And energy, and do less of the energy drains, the grains. Well, things that drain your energy also raise inflammation. Things that give you energy lower inflammation. That's why stress reduction gives you more energy. So you have a model you can start playing with, because maybe you don't feel like going to exercise. Well, you could do some breath awareness, or you could do a little of your spiritual work. You can work at any level you want. It's there. You cannot say to the force that I didn't know what to do, because unfortunately you were here today. The ones that left, they can say that. Okay? All right. So this is what it looks when you make your own plan. You see, for each area, for exercise, you be specific. I would rather you went for a 10-minute walk twice a day or 3 times a day than a half-hour walk once. Because every time you go into it, you develop the mindset that I will take care of myself. Breath awareness. When push comes to shove, I think the power is in the spirituality, because you're wired for it. And again, if you already have it, you got to use it. Okay? Don't become a religious nut, but be as spiritual as you can. In summary, it's really about eating, a diet, and lifestyle. Okay? Just give the body what it needs. Pay attention to the mind. The mind and the body are connected. Okay? And all that stuff, again, all the things that lower inflammation give you more energy. And you can do mind, body, spirit approach. increase the detoxification. That's where you might need somebody to work with like myself. A lot of the other stuff, you know how to increase micronutrients. Get that smoothie going. I got like 30 of them here. They're going to go to the highest bidders. Okay, we're going to auction them off. All the money goes to your organization. No. No, but we have some of those here and some of my cards. But again, I urge you, create. See, I'm not good in business. I'm not good in marketing, because if I had done it right, I would have brought a bunch of these, because it's a great book based on what patients tell me, because it gives you a way to put it all together. That's how you can take your life back, okay? But I will tell you that it doesn't sadden me that you would have to go through the pain and discomfort. What saddens me is that you will go through all this and not grow from it. That is what saddens me. And I always tell that to my patients, that, especially the young ones, dude, you don't know how mature you're going to come out of this. Because I know that we can help you. I mean, I've done this long enough. If you work with me, I know we can help you. But I'm not going to do it. You're going to do it, and I get all the credit. Okay? No, and when we have to, we use guys like Dr. Doshi, but he's not going to cure us either. The best chance of curing is you understanding how you're influencing your genes with your attitude, with your thoughts, with your lack of prayers, with your lack of sleep, with your worrying, and not to bash anything, and please don't bash yourself. One of the things I often tell my patients, do not criticize Gracie. You know, like I tell Gracie, don't criticize Gracie. You know, you just do what you can, okay? Joe, don't criticize Joe. Just do what you, and keep trying. Learning is repetition. That's why you hear me repeat again and again. It's all about inflammation, and it's really the boss in your court, and it's really a mind, body, spirit program for energy. Whatever gets you energy is probably going to lower inflammation. Okay, and I'm going to, hope it wasn't too long. Oh, come on. Go on with you. No, laughter. That's one of my favorite ones, right? It lowers inflammation. So you make your own lifestyle, like I said. Okay, things that lower inflammation.